Good afternoon, everybody. Welcome to the Thurston County Board of Health meeting for the month of September. That's September 10th. I'm your host, Robin Vasquez. I want to call the meeting to order at 3:48.
I would move to approve the agenda.
Thank you. There's been a motion. Do we have a second? Second. It's been moved and seconded. Is there any discussion of our agenda as posted? Hearing none. All those in favor of approving our agenda, please say aye.
Aye.
Any opposed? Hearing none, we have an agenda. We also have meeting minutes from August 13th. I would entertain a motion to approve our meeting minutes. Is there a second?
Second.
It's been moved and seconded. Any discussion of the meeting minutes from August? Hearing none. All those in favor of approving our meeting minutes, please say aye.
Aye.
Any opposed? All right, we have meeting minutes. Thank you. The next item on our agenda is a proclamation. We have a proclamation recognizing September as Suicide Prevention Awareness Month. So I would like to start with Tanzania. You have the proclamation in front of you. It's in the packet.
Absolutely.
Please proceed.
Whereas September is National Suicide Prevention Awareness Month, and September 8th through 14th, 2024 is National Suicide Prevention Week, and suicide prevention is a priority in our community. And
whereas between 2020 and 2022, suicide rates in the U.S. increased by 5%, and one suicide death occurred every 11 minutes in 2022. And
whereas in 2022, suicide was the 11th leading cause of death in the United States and was the second leading cause of death for age groups 10 to 14, 15 to 24, and 25 to 34 years old in Washington State. And
whereas in 2023, 17% of 10th graders in Thurston County reported seriously considering attempting suicide in the past year, and 12% reported making a suicide plan in the past year. And
whereas there is no single cause for suicide, there are known risk factors such as social isolation, childhood trauma, and mental health struggles. And
whereas recognizing the importance of checking in on and supporting one another is something every one of us can do. And
whereas talking about suicide does not increase the risk of suicide. Instead, it can reduce anxiety, open up communication, and lessen the risk of impulsive acts of suicide. And
whereas local groups, community partners, residents, and many others are working to increase awareness of what can be done to prevent suicide and provide resources in our communities, such as the question, persuade, refer, OPR, suicide prevention training, and
now therefore be it resolved that the Thurston County Board of Health hereby proclaims September 2024 as Suicide Prevention Awareness Month in Thurston County and encourages all residents to envision a world dedicated to saving lives and bringing hope to those affected by suicide through prevention, education, advocacy, and resources. Adopted this 10th day of September 2024.
thank you. I believe we have some speakers here, guests ready to join us at the table. Can I invite Jason Bean Mortensen from Olympic Health and Recovery Services and Lori Montoya from Public Health and Social Services to the table.
I'm Elizabeth. I am the maternal child health education and outreach specialist with Thurston County. I also do a lot of work on suicide prevention. So in your packets, we have this one pager that just kind of goes over the impacted populations of Washington State, but also just kind of want to tell you what we're doing here in Thurston County, and one of them is QPR, so question, persuade, refer, suicide prevention training. It's 90 minutes. We offer it free to the county or anybody in the county. We provide it to schools, the library, anyone who wants it can have it. And we are also doing a lot of work with mental health in support groups, such as our bereavement support group and our postpartum support group that we offer for free at the Lily Road building. And then we are just doing a lot of outreach efforts, and one of them is doing videos on suicide prevention that we actually have in the movie theaters right now. So it plays right before the movie, which is really cool. And then we are doing some electronic billboards, and then we do a lot of community events where we share our resources that we have created. And I did bring them. We have updated our mental health brochures, and we have one for our LGBTQ youth. We have one for just our general youth, and then one for just adult mental health. And so we can pass these around if you guys wanted to have them for yourselves. And then we also update everything on our website, so anybody can go in and download them and have them for themselves.
Recording in progress.
Hi, my name is Erica Dennehy. I'm the new clinical director at Olympic Health and Recovery Services, and not Jason B. Mortensen.
Welcome.
Thank you. Thank you for giving me an opportunity to speak today, and for recognizing September in this important proclamation. As we're all aware, suicide has a profound effect and impact on communities. And it's not just a mental health issue, it is a community issue. It claims the life of nearly 50,000 Americans every year, and that number is growing. At Olympic Health and Recovery Services, we provide jail diversion services, hospital diversion services, and a crisis continuum of services, including a regional crisis line and mobile crisis outreach, and are embedded in several jurisdictions to provide co-responder programs. Each month we receive approximately 300 calls from individuals calling in a moment of despair, whether they're calling for themselves or calling for someone that they care about or are concerned about. It has been amazing in my career to see the transition in the crisis supports that are available. 15 years ago, the supports were not in place. The fact that I'm sitting in this room and discussing suicide, and that you all are looking to destigmatize mental health and suicide, is a huge step in the right direction. You know, one of the things that I've recognized the most is that we're starting to ask questions to the individuals in crisis on how they want interventions provided, whether it's an anonymous call over a regional crisis line or whether it is a face-to-face interaction. And we've found that so many people are wanting that mobile crisis outreach. I looked at the stats before I came today and found that just in this year alone, January through June of this year, we've provided over 7,100 mobile crisis outreaches to individuals in need, which is astounding. That number has increased significantly in the last 2 years. And the rates in which we're responding, 92% of those occur within 2 hours of receiving a call. So pretty exciting that we are getting referrals from first responders, that we're collaborating and partnering with individuals in the community to make sure that we are aware of the cultural needs that people have and are providing resources to that. So thank you for making this proclamation. Thank you for recognizing and communicating with the community that this is a priority, that mental health matters, that individuals shouldn't have to suffer alone.
Can I ask some questions?
Absolutely.
So I guess I wanted to highlight a couple things. One of the things you said is that you're receiving referrals from law enforcement or from first responders who are out there in the communities, and they recognize now that somebody may be having a mental health crisis. Mm-hmm. And you said we've come a long way. That's the kind of story where in the past, I think a first responder or someone in law enforcement might have been asked to try to de-escalate or assist that person themselves, right? And so now the fact that we built this partnership between your organization and organizations like it and first responders means that we're connecting people with the folks that are trained to provide them with the services that they really need, that can be most helpful to them. Instead of asking someone who may not have all that training, who may not be a credentialed medical provider, in the mental health field to try to help them. And that, maybe there's not a question in there, that's just a remarkable evolution that seems like it is really gonna be benefiting our community members in need.
You know, with several co-responder programs, it pairs law enforcement with a mental health professional, and ours is a little bit different in this region, especially for the fact that 85% of the responses that we have do not include law enforcement. They may be referring, but we are responding without them. We're providing the right service at the right time to the right individual in need.
It's very lean. Yeah, I know Lacey has a mobile outreach team that does this kind of work in partnership with your organization. And so we've gotten a lot of very positive feedback that that's working well, that model.
Right.
I know that, you know, in the proclamation, it talks about that discussing suicide does not make it more likely that someone will commit suicide. And that right there just feels like an evolution in the way that we address this issue that affects our communities. And has anyone else had the opportunity to take the mental health first aid program, like the mental health first aid courses? Yeah, that's one of the main things they teach you is if you're concerned about someone, if you're not sure if someone might be thinking about suicide, have the conversation. Like, it is super awkward, right? If you're not sure and you think maybe you're wrong, maybe they're not, and maybe they're gonna react badly to that, initiating that conversation, but you could save somebody's life.
Absolutely. By just bringing up the conversation, I think it's so important that we open up that communication in venues where it traditionally hasn't occurred. I see a lot of work that youth mental health providers are having in that prevention and recognizing it and communicating with families on warning signs and risk factors and those things that are so important.
I've had an opportunity to take the training as someone working at a state agency and not a direct service provider. So access to that kind of training can be beneficial for not just service providers, but also policymakers, just to have that understanding of how we can help. Do folks have questions or comments
I
about
did,
this?
I had a technical question, and you named it with that specific training, but I was curious about what training is provided to the schools, or you said that there's a training that the county provides for free. Like, who provides that, where does it come from?
I do. So I do the QPR, and anybody can request it. The school districts do have their own version of suicide prevention. And so if teachers request to have, I guess, the county's QPR version, they can have it, but they do have their own version. It's just not, it's not the same, it's a little bit different.
You mentioned that 85% are not referred, I think, by the law enforcement.
Well, no, of those that are referred, our responses to those crisis outreaches, 85% of those do not include law enforcement being present during that crisis intervention.
Do you have those street teams, like the chairs?
Outreach team?
Yeah, that are, how are they doing? They're not officers, they're responding, trying to solve the problem. Do you know, how's that work?
It's working really well. Yeah, it's working really well. I think big considerations we always take into mind is safety concerns, and that's generally when we bring law enforcement, but making sure that we can provide kind of a less restrictive atmosphere and trying to connect those individuals with different resources during their crisis. Does that help answer your question?
Yeah, thank you.
Yeah.
Do either of you know, does the county play a part in search engine optimization? When people are searching for resources, has there been work done on that?
I feel like that might be a Renee question.
Well, I would like to point out that somebody's working on it, because when I Googled Thurston County suicide prevention, the very first thing that popped up, it says at the top, help is available, and then it lists the 988 helpline. So it's just more evidence that we're thinking about things a little differently than we used to, right? So if I was a person in crisis and I didn't know where to start, and I had searched like suicide prevention, the first thing on the top of Google is, this is the phone number you call. And it's that short, easy to remember phone number. We'd be remiss if we didn't mention it, 988. That's real cool.
So on the handout, it shows that Washington State, there's a significant amount of veterans, non-Hispanic American Indian and Alaska Native Also, if someone's from a small town, so less resources, and disabilities and LGBTQ, those are all kind of risk factors that might raise. Do you find that reflective in the Thurston County population? Is this something that you've adjusted to for the outreach?
I can speak.
Sure.
Yes, we have. We've seen it reflective. We've also been very cognizant of making sure that our mobile crisis outreach, our regional crisis line, that those staff are being provided education on best practices as well as resources available to be culturally aware of what's going on and how to provide that support. Which again is something that I think 10 years ago wasn't happening. So I see a lot of these systematic improvements overall.
Can I ask, there's survey data on here for the Thurston County Youth Survey. What was the population that responded to that survey?
I believe, I don't have the exact number,
I don't want
but
to put you on the spot,
if
but
you
I'm
go
curious how big
to-
it was.
no, if you go to our website, under data, I actually have created a PDF of all of the Healthy Youth Survey answers, and it will tell you the data selection.
We can pull that and supply a report for the next meeting.
Thank you.
I did have something to piggyback off of what Perla just mentioned here. So the 255 veterans who died by suicide accounted for 20% of all Washington deaths. So that's almost a quarter of the entire state. And I see that we've created some new pamphlets and some new media specifically for like LGBTQ or youth. Has there been any like high-level conversations possibly with like the VA or local veterans that are also providing those resources that maybe we can partner with just in terms of messaging? Like if we're creating specific messages for populations of people, this is a pretty significant population that seems like they would need it.
Yeah, we have started those conversations. I'm fairly new to the role. I've been in less than a month, but I know those conversations have been occurring to make sure that special populations are aware of the resources that can provide those services. Yeah, I know those conversations have occurred. And I know there's collaboration with that as well.
Thank you.
I just wanted to say, a number of us here have partnered with your agency here for a long time, and it's really good to see you here, and thank you for your work. And also curious about how the transition to 988 has been working out for you recently. I know that that's been a little bit of a slog for the last couple of years, making everybody work together. Is it improving?
I think it is. I think with any large system improvements, there's going to be some challenges along the way in communication and making sure that people are aware of the resources available. We have regular communication with 988 as well as 911 to make sure that that is a smooth transition. It may be clunky on our end, but we definitely don't want the individual that's calling in a crisis to feel that or experience that. So regular conversations, regular email updates on how many calls we are receiving, how many calls they are receiving in different areas, yeah. So it's a lot smoother, I'd say, the last 6 months.
And then as a provider who deals with people who are suicidal, having programs that are the mobile crisis units is like life-saving for the providers as well, because we know they're getting help, and it's not like I will stay up all night worrying that they're okay because I know you guys have them.
Yeah.
And you're making sure the family is doing safety training and everything. So I'm grateful for the services you guys do.
Yeah, and our mobile crisis team is able to follow up even after that crisis. If the individual wants follow-up phone calls or it's 3 days a week they want to check in, we really try and accommodate to the individual's needs to make sure that they are being provided the services, especially as they transition into kind of longer-term services.
Any other comments or questions?
I have some comments. I just wanted to first say welcome. I know we briefly spoke over email when I welcomed you over email, so it's really nice to meet you in person. And I'm excited to work with you. I also wanted to say, as far as like 988 goes, I'm actually really looking forward to setting up a meeting with with staff. I think we spoke with Joe regarding a meeting in support of the Education and Outreach Subcommittee, and we had some questions about 988. So I think that there's a meeting in the works being scheduled for maybe in October. So I'm looking forward to that conversation too, and kind of learning more about how that's working in our community. And then also just kind of in general, I wanted to make some comments about like hearing how much progress we've made is really, it's good to see how much progress we've made with a situation like this or with an issue like this. It's like kind of hard. It's like these statistics are just like staggering. It's really like my heart is like pounding just even thinking about it because it's so sad. And like, I wanted to say like, I don't want to diminish the progress that we have made, but this is like a systemic issue and it is so pervasive. And I think that it's important to acknowledge like how systemic issues kind of manifest within us as individuals too, and how each of us are responsible for contributing to the collective response that's needed to address situations like this. And we can't control the outcome for people, and even as a jurisdiction or a body, we can't control outcomes, but when we do have control over some situations, we should do whatever we can to help prevent suicides. And I don't want to, like I said, diminish the progress we've made, but I think it's important to highlight that within our own systems in the county, suicides occur. And especially amongst people who are cycling through like the justice system or, you know, mental health services, and they're in and out, and there's not really like any continuity of care. There was recently a notice issued by the sheriff's department about a suicide that occurred in the jail. And I'm thinking like as a county, how can we ensure that when people are in our facilities, this is not happening? So I just kind of wanted to like highlight that and just kind of share some of the thoughts that I'm having as we talk through it. But I really, really appreciate the work that you do because this is so important and it affects so many people. So thank you.
Yeah, absolutely. I think we're heading in the right direction, but I still think we have a long way to go. Absolutely.
It is heartening that we're starting to focus on and provide targeted resources at people that we know are in either vulnerable populations or in a vulnerable moment in their lives.
Mm-hmm.
You know, this body put forth a proclamation on maternal mental health a few months ago because we know that that's one of the risk times, right? Like all of our data, our statistics now shows us that the postpartum period isn't the 2 weeks after childbirth, it's really more like a year. And women need that support. So, yes, I echo Commissioner Klaus's comments. Thank you for your work.
One question, this might be a dumb question, but at what time, what age is it appropriate to talk to your kids about suicide?
That's a tough question. I'm almost looking towards Heidi over there.
Different role.
I know.
It's always good to talk about suicide.
Yeah, I think, you know, I have a young child, and I know that those discussions are happening younger and younger, and I think it's important to. And not so much suicide in general, but recognizing emotions that can happen and different interpersonal relationships that can happen at a young age and impact our self-image, how we view ourselves, how we view the world around us, and also how trauma plays into it. So not a direct answer, but I think those conversations about mental health are happening younger and younger as part of that suicide prevention.
Well, and even in the proclamation, it says that suicide was the second leading cause of death for age group 10 to 14.
Yeah.
That's really young, it feels like, but so probably even before age 10. Like I've got a 7-year-old and a 10-year-old at home, and it honestly has never occurred to me to talk to them about this, but I think maybe I will.
Yeah, it's a daunting thought for parents, myself included, but it is important because it's a reality.
So is there resources that speak to how you approach that subject with your child? Or
Yeah, there are resources that are available online on how to have those conversations. I think it's
there's age appropriate?
Yeah, there is age appropriate to have those conversations. I'd be happy to provide some of those to the board if you'd like.
That would be great.
Yeah.
And then I think also kids will be impacted if they have a family member or someone they know, like a neighbor, who does it, and you'll
You've
have to
experienced
sometimes, talk about it at different ages, so I think that would be great to have the resources for people.
Yeah, absolutely.
And just to throw out, there is a program for children in crisis specifically.
Yep.
That can help with that.
Through Catholic Community Services. They have great programs and our crisis team works with them regularly.
All right. Any final thoughts or comments? It was a good discussion. Thank you again. Renee, did you think we would take a photo? Can we step outside and take a photo with you all on the proclamation? It's online, we'll be right back with you.
No, why are you saying no for?
Nothing. I said, what happened? I said, oh.
There is no Apple Cup anymore. Huskies ruined that.
The college I attended
That's right.
ended its football team, so I don't have any opinions about any of that. Yeah, let's go.
My daughter's a Cougar, so she went to WSU.
We come from a blended family. It's always good
Contentious,
arguments going on.
contentious
I
holiday
just stayed
dinners.
out of it, I didn't go either.
Yeah.
Kinda wanna get in the middle of this.
All right, well, welcome back, everybody. The next item we have on our agenda is an opportunity for the public to address the board. Do we have anyone signed up for public comment? Seeing none, moving on. Department item, Board of Health Strategic Plan Subcommittee updates. Jacqueline, would you like to kick us off?
Yeah, of course. So most of the subcommittees have had their second meeting. Our policy meeting with Ty and Carolina, we went through some of the policy needs of our internal staff with PHSS. We went through them, kind of identified that we have to determine what we actually have control over as a Board of Health. So that's something that I am going back to look at and make sure we have jurisdiction over the things we're wanting to change. Our data subcommittee met with the EPI team from PHSS. I think it was a really great conversation. They learned about the science of epidemiology
kind of how they gather data, where they gather data from. And so next steps is to kind of hone in what we're gonna do with data. And then our education and outreach subcommittee didn't meet since the last meeting, but they are meeting on Friday, so we will have an update then. Yeah.
Anybody on any of those subcommittees want to add anything?
I guess I'll add on the policy. I mean, the first meeting, we were kind of the, I felt like we were kind of the afterthought subcommittee in strategic planning. And in fact, the first half of the first meeting, we actually reversed the phraseology of what we were going to do. And then we talked about, well, what are we going to do exactly? Like, what is this committee doing? I mean, is it about just supporting other policies that come up, you know, a support letter for this or that? Or are we, I had envisioned it more of like a vetting, a kind of distilling the key, working with staff to kind of distill the key policy issues that might need some attention, or at least be good subjects for potential action by the board. And so we agreed that that was a kind of a good way to go about it. So we tasked Jacqueline and to kind of follow up with staff and kind of just get a bunch of ideas and let's just, and you know, Commissioner Mejia and I threw some in, but we came back to our second meeting with kind of a laundry list of things, housing related, community wellness related, TST related, environmental health related, and then we just kind of talked through each one. Some of them we were able to go, that's not something the Board of Health should be dealing with or can't deal with. Some of them were like, maybe we could deal with that, but we're not sure if that is outside of our lane. Can we follow up with prosecuting attorney or get some legal advice? And then other ones, we just needed more information from staff. So we gave some specific, points to follow up on. And at the next meeting, our hope is to sort of take all that follow-up information and then kind of weed it down to 4 or 5 that we could bring to this board to kind of just, not that we would work on 4 or 5, but a choice, we don't want to make the decision. We want to just present the best 4 or 5 possible options. And then this board could talk about, hey, do we want to, what would be the reason to take action on this thing? What is it? And then if it is, we could tee it up for future discussion. So that's kind of where we got to.
That's a lot. Sounds like a good meeting.
Yeah, pretty good.
I can speak for the data subcommittee. It was lovely to have the epidemiologists come and explain a little bit about the work that they do for the county and the way that they gather data, the data sources that they pull from. There were a whole bunch of links in the chat of our meeting by the end, like different resources that the epi team was sharing that got sent out. And so I can send those to the board in case folks are interested in just having a list of data-related resources that the county relies on when they're putting together their reports. But we talked a little bit about, okay, so there's a lot of data. Are there things missing? Or from among the data sources that we have and the reports that we have, are there things that we could uplift or share with the community so that the community has a better understanding of the data that is used to make decisions at the public health, like here with the Board of Health and with Public Health and Social Services. So we might be brushing up against the education and outreach subcommittee's work, so maybe there's an opportunity for partnership there. If we find some spots where we would like to just share the data that exists with the community, maybe we can work on that as 2 subcommittees in partnership. Anybody from the education and outreach group?
Yeah, I'll say, I'm excited to hear that because we said the same thing. In our group, we were like, we should collaborate with the data subcommittee.
Overlap.
Yeah, there's definitely some overlap, so it's good to hear that came up. I mean, I'm on both, but I missed the first data meeting, so it's good to hear that that's a conversation that's going on. I'm also realizing, looking at my notes, it wasn't 988 that I wanted to schedule a meeting about, it was 211. You probably knew that when I said it, but thanks for not calling me out. Yeah.
3-digit phone number.
Yeah, I'm like, these 3-digit phone numbers, and if I can't remember, then maybe we need a pamphlet for the community, because I should know.
What's 211? I know 988. Some mental health number. No.
Yeah.
Or is it the one you call before you dig? Wait a minute, don't confuse me.
We need a list.
Like
That's what I'm hearing.
resource hub where you can go to find different resources.
Community local.
Yeah,
Yeah.
local.
So you call up and say, hey, I don't have a place to sleep tonight. And they say, oh, here are the places you can touch base with. you know.
Beyond behavioral health concerns.
Oh, yeah,
All
like,
the
yeah,
social
like
and
I need,
resources for children.
I need formula for my kid and they can pull up all this stuff.
Is that statewide or county or?
I think it is statewide.
It's a statewide number, but they provide you with local resources.
Apparently I need to be at that meeting, you know, so.
Yeah, I'll make sure we get an invite because there were some scheduling things, so we pushed it out to October. But yeah, I want to know more about that too. I'm really interested. Yeah, I think that's all I've got for that.
All right. So it sounds like the subcommittees are in various stages, but we're all in movement. So we'll keep reporting out, we'll keep doing our good work. And yeah, it's fine if we're forming and storming and norming. The subcommittees are brand new. So it seems like we're moving in a positive direction. Now move us to the next item on the agenda, which it feels like we sort of shifted into anyway, and that's open board discussion and information sharing. Anybody have anything interesting to share? We learned about 211.
Actually, shout out about 988 really quick.
Yes.
The difference between 211 and 988. So 988 is now nationwide, and instead of calling 911 like you would for any emergency, you call 988 for a behavioral health emergency situation. And it's nationwide, and all of those numbers get funneled to the local crisis providers. But having been in that seat myself, that's why I asked that question. It wasn't funneling very well at first. And so it's really good to hear that it is funneling better. But yeah, there's lots of numbers to call if you need help, and that's a blessing and sort of a curse in a way. They're all different. And that's what 988 is trying to solve.
Yeah. Getting you the right resources, tailored local resources where possible. We have any exciting vaccination events for the community coming up? Seeing nods.
One more vaccination clinic and it's on your report, the health officer and director report.
Yeah.
Other things in the packet that I would like to point out, at the last Board of Health meeting, there was a question about the increased rates of death in Thurston County in 2021 and 2022. So our team put together a report just kind of summarizing what they gathered regarding data or overdose deaths and opioid-related deaths. So that's there for you. And I also included the email that Commissioner Mejia shared as well with the coroner's information.
So we also have information about distribution of naloxone to schools. That was another question that came up during our last meeting.
There was another question that came out. So our team, they provided a little summary of the Senate bill and the House bill that was effective June 6th. That's requiring naloxone in all the schools. Additionally, in the same report, they included information about immunization activities. It came up in the last meeting, kind of how often our clinics are being held and things like that. So our team included that as well.
Thank you. Any other updates or items to share from members of the board?
I have one because I haven't been able to stop talking about it. I toured the coroner's office while they were doing an autopsy. And that is something I will never forget. My mind was blown, and I'm just want to kind of give a shout out to the coroner for the work he does. Really difficult work, really necessary. We talked a lot about the impact on families and the process and how just how it works for family members who are experiencing the loss of a loved one. And I learned a lot. So I just kind of wanted to give a shout out to the coroner and, like I said, share something that I can't stop talking about because it was kind of like, I don't know if life-changing is dramatic, but it's something that really impacted me. So, yeah, it made me think about life a lot differently after watching that. Yeah.
All right. Well, we've reached the item number 6 on the agenda, Health Officer and Department Interim Director Report. And we have a written report in our packet related to viral respiratory illness update, parvovirus, B19, mumps. It's gonna do partner therapy update. Very cool. Are there any questions or comments about the health officer's report? All right. In the health officer's report, we've got community activities, which gives us a list of some of the immunization clinics that are happening, so thank you for that information. All right,
I have a question.
yes.
By any chance, as people are getting vaccinated for whether it's the flu or the COVID virus or whatever it is there any success numbers that go along with the vaccination, kind of preventative? I mean, are people being, is it preventing anybody from coming down, or is it just lessening the severity of it?
So there's a variety of numbers out there as far as prevention. It's hard because so much of the COVID testing right now is occurring in homes and is not reported. So it's hard to look at impact on transmission of COVID on vaccination. But there's some data to suggest that it may reduce transmission, but really where the strength of COVID vaccination is in preventing outcomes of severe disease, so hospitalizations and deaths. There is also some data that suggests that vaccination also prevents long COVID and reduces, so that folks who are vaccinated have a reduced risk of long COVID, which can be which can have a pretty significant impact on people's, lives long-term after, if they become ill. So I think that's, I still recommend that folks get the updated vaccine that's now available in our community. And folks, so I know that we've talked a bit about acquired immunity to COVID from infection. So I did want to mention that folks who have recently been infected with COVID should think about, should consider like what's their likelihood of. So there are a few things to consider after you've had COVID. One is that you do have some antibody protection from infection. The other is to think about folks to think about what their risk is of severe disease and what their risk is of if they don't get it now in September and October, that they might miss out this respiratory season. So my ask is for folks to kind of think about their own personal circumstances if they have COVID, but they can consider waiting 2 to 3 months before getting the updated vaccine if they've recently been infected.
Are the COVID tests better today than they were, say, a year ago, the home tests?
So that I don't have direct information on, but I can look into that.
Okay, thank you.
And one comment I would make is over the weekend I was on call and I had 4 babies with COVID in the ER and I had 1 admitted. So one of the things I'm seeing is a lot of adults are just like, oh, I think I have allergies, and then they're just holding the newborn, and then the babies are getting sick. So just being thoughtful about mild respiratory symptoms, especially if you maybe get mild COVID and are vaccinated. And we're seeing a ton of rhinovirus already, and I think it would be really, I always kind of have people try to time it based on risk. So like, are you traveling? Do you have something important like playoffs? Do you have people who are going to be around at the holidays who are vulnerable that you want to protect? So, we want to make sure you're protected at the most vulnerable time for them. And then obviously we don't want you to get it during the wave and be hospitalized or have severe disease, so.
Have we had very many hospitalizations? I mean, we don't put out information anymore, but is it still happening? More so than, say, the common flu, or?
So So that's another that's another challenging question. So testing is occurring for folks that have symptoms of COVID in hospitals as opposed to uniform testing. We are still seeing folks who have COVID be hospitalized. However, it's not in the numbers that we saw early in the pandemic.
Do we see deaths that are actually attributed to the virus?
So the viral respiratory season is October to October, and there's a significant multiple.
October to October?
Yes.
Like all year?
So it's October so when we think about a viral respiratory season, we start looking in October, so that would be the first week of the new viral respiratory season. So just saying that right now when we're looking back, we're looking all the way back to last October. And so there have been a significant number. Yeah, it's when you look at the state data, it's multiplicative in terms of the numbers of deaths from influenza and RSV versus COVID. So the last time, I looked, there were over 100 deaths for flu, over 100 deaths for RSV, and there were more than 800 deaths for COVID in the same time period. So it's still a real risk in our community, and it's having an impact. And so that's why the Dr. Harvey's recommendations, which are just so important to follow for folks who are sick. Get tested for COVID, get an at-home test. Stay home until you feel better and are fever-free for 24 hours without fever-reducing meds. And then after that, really consider, masking, distancing, taking those additional precautions, because folks who have COVID can be infectious for 5 to 10 days after symptoms start. So it's really, staying home when we're sick and taking those additional precautions are a really key way that we can protect folks, including our most vulnerable.
Still good advice.
And when would you recommend people test if they have an initial negative COVID test? Would you recommend they retest later on?
So yes, so each test has directions. So the rapid antigen tests, many of them are recommend 2 tests somewhere in the 24 to 72 hour window. So if folks still have COVID symptoms and you test negative, I would definitely follow the directions for the specific test that you're using.
That'd be a good idea to retest down the road.
What is the recommended age when a COVID vaccine is appropriate? Is it 6 months?
6 months and up.
So if there's an infant under the age of 6 months, it's likely they can't be vaccinated. So if you've got a baby that's less than 6 months old, be extra careful, right? And people around that infant also be careful, because you might have had COVID 2 or 3 times and you've got vaccination protection, but the baby doesn't. And on that note, I believe we've reached the end of our agenda. Is there a motion to adjourn?
So moved.
Second.
It's a non-debatable motion. We are adjourned. Thank you, everybody.
Thank you.